Hello, I am Dr. Mirela Cernăianu, and I welcome you to the Wellness Optimizing Warrior MD podcast, the WOW MD podcast. I am not your typical wellness coach, and this is not a typical wellness podcast. Here, I'll discuss educational facts about health, hormones, intimacy, anti-aging, and beauty trends, all very hot topics, to empower you to make great choices when it comes to your health and to your body. I want you to go, wow, I did not know that. Or, wow, this is going to make a great difference for me. Our healthcare system is broken and it needs a revolution. You and I can start one today. I am willing to share my knowledge with the world if you're willing to listen. Let's get started. Hello, listener, and welcome back to the WOW MD podcast. I am super excited about today's episode because I am pretty sure it will help you shed some light on the confusing environment regarding hormone replacement therapy, especially if you're a woman gearing up for menopause or a menopausal woman already on hormone replacement therapy, or a man in his 40s possibly dealing with low testosterone and considering replacement, or a man that's already on testosterone replacement. I am also launching this episode on the first week of October, which you might not know, but October has been designated as the World Menopause Awareness Month, with October 18 celebrated as the World Menopause Awareness Day. So I promise you that the entire month of October is going to provide you with a ton of information about hormone replacement therapy, menopause, bioidentical, synthetic, natural, which hormone is best, which one is covered by insurance, which ones are not, which one has the least side effects, which one carries more risks, etc. I will give you everything I can in the next few episodes. Just keep listening. I wanted to do this podcast specifically because I get a lot of questions about hormone replacement therapy. And as I told you in my very first episode, the reason for the podcast is very selfish. I really hope that all of my clients that seek hormone replacement therapy and hormones in general or any other topics regarding their health will eventually listen to my podcast. So now all my clients that have listened to the podcast will be educated, will feel empowered, and they will be ready to make choices when they have a new visit or a follow-up visit with me. So should I start by giving you the answer to the question, which hormone replacement therapy is best right away? Or should I present you with the data, the science, the known facts, and let you decide? I'm actually going to give you the answer, but it's probably not what you think. So again, the topic of the podcast is what is the best form of hormone replacement therapy? Just like the diet, what is the best diet? There is no the best diet. It's the best diet for you. So ideally, the best hormone replacement method is the one that makes sense for you, the one that you're going to be compliant with, the one that fits your beliefs, your knowledge, the one you feel comfortable with, the one you trust, and the one that you have faith and confidence in will be the one for you. And last but not least, the best hormone replacement method is the one that fits your budget. What's the point in looking and shopping at Louis Vuitton if you can't afford it? Why did I stress the trust, the faith, and the confidence in the hormone replacement method? Well, you know just as well as I do, it's not just about placebo. Hormones are way superior to placebo. However, it is a very well-known fact that your mental approach to a therapy can ruin it, make it fail, or optimize the success of the therapy. Now, you might think that this answer is somewhat vague, but just hang in there. I'm going to give you a lot more details and make it way clear. So, first of all, how would you even start by choosing a method to replace your hormones? Well, ideally, you would have a consultation with a doctor that is familiar with all the methods of hormone replacement therapy and who can explain the pros, the cons, the difference between them, and who will allow you to make a decision on your own, maybe help guide you in choosing what is the best method for you by answering your questions and hopefully by providing some educational, valuable knowledge or some material in the form of a brochure, a blog, a podcast. But that is not really what happens in the real world. So let's talk about the real world for a minute. Many women discuss low hormones or menopause with their doctors. Many, probably all of them. They are all symptomatic, they suffer, they are in need of a real solution. Instead, they are told it is normal. It's the way of life. You don't need hormones. Many women are told hormones are bad and they can increase the risk of cancer, which is not true and a terrible misinformation to be spread about by a medical professional. Many doctors are not familiar with anything other than what the latest big pharma rep that came into their office told them. Well, they might be familiar with what they heard at the last conference or symposium they went to that year, which is a quick 30-minute update. They might have retained some information, maybe they didn't. Some doctors or providers are trained in one method only, and that's all they offer. And they do not discuss or offer any of the other methods, either because they're not trained or they simply don't want to offer them. But ultimately, many other methods are not even mentioned. So I feel that there's a huge need for education here. And I do hope to fill in this gap and provide you with lots of useful information that would help and empower you, as I promised, to make the best choice for your body and for your health. And this happens not just with women, but many men are not even tested for testosterone levels. Maybe because the doctors are not comfortable enough with testosterone level testing. And then if you test them and they're low, what are you going to do if you don't offer testosterone replacement? Maybe you can just say, hey, seek a testosterone replacement specialist. But that doesn't really happen. Most of the times when, and if they do test their male patients for testosterone, most of these clients are told in a very reassuring tone that their testosterone levels are in range. There's nothing to worry about. Meanwhile, their testosterone is 300, 400, 500, because the range for the lab on Quest or LabCorp says 200 minimum, 900 maximum, or something like that. It looks okay, right? It's in range. Well, how come doctors don't ask or don't bother researching what is the ideal optimal testosterone in men and simply go with what the lab offers them? Why does no one challenge the status quo when we know such low testosterone values, 300, 400, definitely not 200, are not good for men? Optimal testosterone in men is more likely to be 800 to 1200. And interestingly enough, this range has changed over the last decade, and now the lab range is interestingly much lower. I wanted to start this podcast by planting some seeds into your mind and hopefully make you want to ask more questions and not always take the answer you are provided, especially if it does not seem right to you and it doesn't fit your picture. So before I dig deep into hormone replacement therapy, I want to let you know I personally offer all methods available to my clients. I let them choose, and sometimes that is a problem because they lack the information and they feel that at the time of the appointment, they don't have enough data. They don't have enough information to help them make a good decision for them. So if you've ever felt that way, or if you're one of my patients who has exactly experienced that, and I do get that feedback sometimes like, I don't know what to choose, please choose for me. That's not my role. However, if that's the case, please keep listening because I really hope you will feel a lot better after this series of episodes. So after this short intro, let's get back to our core subject. What is the best hormone replacement therapy. Number one topic is, are bioidentical hormones superior and better than non-bioidentical hormones? And let's talk a little bit about what bioidentical means. Well, I'm going to make it very simple. Bioidentical hormones are hormones that are biologically identical to your own hormones. Do not confuse bioidentical and non-bioidentical with synthetic and natural. They're two different things, and I'm going to touch on that in a minute. But let's discuss specific sex hormones. Let's talk about available testosterone therapies first. I've been talking about the subject of testosterone for quite a few episodes now, so it's fresh in your mind. So let's talk about what testosterone therapies do we have available. Well, if your body makes testosterone, then testosterone is the bioidentical form that you want to use for replacement. However, let's start with men. The most common form of testosterone replacement in men is injectable synthetic testosterone in the form of testosterone cypionate or propionate. These are synthetic testosterone ester derivatives that are very similar chemically, but they are not bioidentical. However, since they are considered prodrugs because the body converts these forms of testosterone into bioidentical testosterone, technically, they're considered bioidentical by many providers and by many patients. So we have testosterone injectable therapy for men. That is the most common used form of testosterone therapy. We also have synthetic non-compounded bioidentical testosterone gel, 1%, that's FDA approved for testosterone replacement in men. What about compounded testosterone? Compounded testosterone is bioidentical. It's still synthetic. We have to synthesize it. The pharmacy synthesizes it. It is plant-based, derived from Mexican yams. And we can have a bioidentical testosterone cream or pellet insertions every 6 months. So there are injectable testosterone, transdermal, gel, or compounded creams, and pellet therapy for men. There is no effective and safe oral testosterone therapy available by mouth because oral testosterone is subject to the first pass effect, which means it goes straight to the liver to be metabolized. Previous synthetic testosterone compounds like methyl testosterone that was used way back had been associated with serious liver toxicity effects. So an oral testosterone formulation that meets the current rigorous regulatory standards for safety and efficacy is missing from the armamentarium of testosterone replacement therapy products for men. What about women? There is no FDA-approved testosterone available for women, but many trained physicians that are knowledgeable in testosterone replacement therapy for women use either compounded bioidentical testosterone creams, which are administered daily. They can use weekly compounded testosterone cypionate injections. Those are not bioidentical, but they're technically bioidentical, or compounded bioidentical testosterone pellets inserted every 3 to 4 months. So at this point, you might be asking yourself, which one should I choose? If you're a woman, always consider the reason for the therapy and then choose the one that's most likely going to provide a solution for your problem. For men, it's simple. They're tired, their muscle mass is going, it's being replaced by fat. They start to accumulate weight around the midsection. Their mood is not good, they get more irritable, and their sexual desire is low. And they have erectile dysfunction. Every single one of these symptoms is effectively solved by any testosterone therapy that a man chooses to use. Some are more effective than others, some last longer than others, and some are more convenient than others. But for women, it's very different because it depends and it hinges on bioavailability. I will talk soon and explain bioavailability in another podcast. So I want to provide more information about that so it helps you make a good decision. But I'll give you a little preview right now. If you're looking for an improvement in sexual desire, mood, energy, and specifically weight management, then you want steady levels in your bloodstream circulating around 24/7. You really don't get that for any daily or weekly cream or injectable testosterone therapy. You only get that from pellet therapy. And even that has limitations because there is a upswing and a downswing at the beginning and at the end of the pellet, but you will have steady levels for 2.5 to 3 months. However, many men and women like that high peak that they get from the weekly shot or the monthly shot in case of a man, and they prefer to manage and replace testosterone using self-administered injections. One other thing to keep in mind is that the daily use of a cream or a gel for testosterone carries the risk of transference. That means applying the hormone to your skin can and will be transferred to your spouse, your children, your pets, and your aging parents, maybe your friends. I always tell my patients if they choose the daily skin cream application, that they personally have the responsibility to protect their significant others from being exposed to unnecessary testosterone levels. For women, we have a very simple solution. You can apply the testosterone cream to the mucosa, ideally at the vaginal entrance. The testosterone gel for men can very specifically linger on the skin, increasing the risk of exposure for household members that come in contact with a man using, for example, androgel. So applying the gel to the upper arms area and covering it with a shirt immediately and showering before contact for intimacy or showering before bedtime are likely very, very good precautionary measures to consider taking to protect your loved ones. So we talked about testosterone. Let's talk about estrogen. Lots to talk about. And this is where all the confusion happens. First of all, let's start with the basics. The female body makes 3 estrogens. There are 3 bioidentical estrogens naturally produced by the human female body. These 3 estrogens are estradiol, estriol, and estrone. Well, which one of these hormones should you use if you and your doctor decide estrogen replacement therapy is for you? Well, you need to know what type of estrogen is the best. And the best and the only one, the one and only, is estradiol. Please remember this. The active estrogen in our bodies is estradiol, not estriol, not estrone. I know they sound somewhat related, but they're not. Estriol is produced during pregnancy. It's a much weaker estrogen. But interestingly enough, it has been compounded for quite a long time, and some women still use these formulations where estriol is compounded alongside estradiol as a product called Biest. Bi for 2 estrogens together and est for estrogen. Now, estrone is a deposit form of estrogen, and it's probably a carcinogenic estrogen. It is a type of estrogen that can result from testosterone being aromatized into estrogen. Aromatization is the process of converting testosterone into estrogen, specifically into estrone and estradiol in men. This is not a good process. Most physicians always measure estrone levels in women that are taking estrogen replacement therapy and estradiol levels in men on testosterone replacement therapy to evaluate aromatization. There are medications that suppress this process and minimize aromatization. Please go back to my episodes of dangers of too much estrogen if you want to know more about this. Let's go back to estrone. In the past, Triest was a product that combined all these 3 estrogens together. As doctors thought the closer we get to Mother Nature, the better. And Mother Nature makes all these 3 hormones in the female body, so let's put them all together in a cream and give it to women. However, as science advanced and the medical world gathered more knowledge and a better understanding of hormones and what they do, the use of estrone in hormone replacement therapy for women was abandoned, at least for the past 15 years. So if you're still using Triest, or you know someone that is, please let them know to stop using it. So there's nowhere more confusion than in the world of estrogen options as far as what is bioidentical and what isn't. And that's why I'm here today. So to recap the term bioidentical hormone replacement therapy, this refers to the use of hormones that are exact, identical copies of your own human hormones, your God-given hormones, including estriol, estradiol, progesterone, testosterone, etc., as opposed to synthetic versions of hormones that have different chemical structures, or as opposed to non-human versions, for example, the conjugated equine estrogens like Premarin. The confusion happens because bioidentical hormones are also very, very often referred to as natural hormones. And this can be confusing because bioidentical hormones are synthesized. They don't just happen to exist in nature. We have to make them. On the other hand, some estrogens come from a natural source, like the equine urine, the horse urine, but they're not bioidentical because many of their chemical components are completely foreign to the human body. So one day I was spending a lot of time talking to one of my clients, explaining all these options. And at the end, she summarized it so well that when I see a confused patient, I quote her. She said, "So, doc, let me repeat what you just said. If I hear you right, FDA-approved products are like GMO products, and the compounded products are like non-GMO because they're plant-based and synthesized from Mexican yams. So they're not made by Big Pharma." And I said, yes, that's exactly right. You have somewhat of an analogy or comparison, which makes you understand a little better the difference between bioidentical synthetic, bioidentical natural. And this is exactly how you should look at it. And this should be a factor that maybe you want to take into consideration when you choose the hormone replacement therapy that's best for you. Some people value Big Pharma and approved FDA drugs. And some people love non-GMO, non-FDA approved, more natural products. So again, having this knowledge might help you choose the best option for you. So let's get back to estrogen. What are some examples of synthetic estrogens? Estrogens that are not bioidentical, that you should probably not use for hormone replacement therapy. Let's start with the no, please don't use. Ethinyl estradiol is a synthetic fake estrogen, is the most commonly used estrogen in the birth control pill. I really can't believe that there are doctors that treat perimenopause and menopause with birth control pills. Please don't use it. Premarin is another typical example of a non-bioidentical estrogen. Premarin contains 17 equine estrogens. Yes, you heard it right. Horse estrogens that have been extracted from horse urine and synthesized into a pill for human women. Technically, Premarin is natural, as it is derived from horse urine, which is a natural product. But again, it is a manufactured horse urine extract containing 17 horse estrogens, some of which are proven to be carcinogenic and induce mutations. Premarin is also available as a vaginal cream. If you are ever offered Premarin pill or Premarin cream or Prim Pro, which is Premarin with an added synthetic progestin, please say no. I don't want it. I heard it's bad for me. You are right. It is bad for you. We have better, healthier, safer options. There is no reason in today's modern world, with all the other options we have, for a doctor to prescribe Premarin, Primpro, or birth control pills. Well, what about the patch? The patch is absolutely used by millions of women as hormone replacement after menopause and is touted as bioidentical. However, it contains estradiol hemihydrate, which is a slightly different estradiol than our pure estradiol. But because it's very similar, it's technically considered by many to be bioidentical. But it is not. It has a slightly different molecular structure than our God-given estradiol hormone. If you don't believe me, please Google estradiol hemihydrate, click images, and then Google estradiol and click images, and you'll see the difference. Also, the patch has many downsides, some of which are allergic reactions to the ingredients contained in the patch, and there's lots of residual adhesive in the area of application, sometimes for many days after removing the patch. And since I am talking about ingredients contained in the patch, please be aware it contains polypropylene glycol, povidone, which is actually iodine, anhydrous colloidal silicon dioxide, pressure-sensitive acrylic adhesive, copolymer foam, etc. So it's not pure, and I mean nothing is pure, but please be aware that you have the adhesive, and then you have all these other ingredients on top of the estradiol hemihydrate. That is the patch. So what else is there for estrogen use? Much less known are the 2 estradiol rings, the vaginal rings for estrogen. One is bioidentical and is GMO manufactured, like my patient said, GMO, and FDA approved and contains estradiol in a bioidentical form. However, it also contains silicone polymers, barium sulfate, and silicone fluid as a dispersing agent, which are all combined to form the ring. When placed in the vagina, the S-string, which is what I'm talking about, releases a very small amount of estradiol in a very consistent, stable manner over 90 days. However, this type of ring is mainly used for local relief. The other ring is called femring. It's not bioidentical, but contains estradiol acetate and releases a much higher dose of estrogen than the S-string. The femring is used for systemic relief of menopause. So again, S-string, low dose, bioidentical, femring, higher dose, helpful for menopause relief, but non-bioidentical. Plus, these 2 formulations are extremely expensive. And I found that from all the patients I prescribed these rings to, none of them come back saying, I'm using it, my insurance covered it, I like it. Most of them decide to use it for some reason or other, they like it, they continue paying out of pocket. And the cost is somewhere between $500 to $600 for 3 months of ring. So let's keep going. What other options of estrogen replacement do we have? Well, let's definitely talk about oral estradiol. Just like I mentioned earlier when I talked about taking testosterone orally by mouth, using estrogen in the form of a tablet is best to be avoided. It will go straight to the liver to be metabolized. And in the process of being metabolized by the liver, will generate a large amount of bad estrogen, estrone. Oral estrogen is bioidentical, is synthetic, and FDA approved. It's extremely cheap and all insurance plans cover it. Very few doctors continue to use it and prescribe it. More recently, a few FDA products have made their way to the market, offering oral estrogen and oral progesterone, both bioidentical in the form of a pill called Bijuva. However, please know that every study that compared oral with transdermal application of estrogen came to the same conclusion. Transdermal estrogen for long-term use is much safer and healthier, whereas long-term use of oral estrogen carries the risk of stroke, heart attack, and increased clotting. So if you're considering being on hormone replacement therapy for more than 1 to 2 years, please do not use oral estrogen. What about estrogen creams? There are no FDA-approved estrogen creams. The estrogen creams applicable to the skin or mucosa are compounded, but there is synthetic FDA-approved estradiol gel that can be applied to the skin daily. Estrogel, Divi gel are examples. The natural plant-based estrogen made out of Mexican yams will always be compounded, and it's not FDA approved. Many women prefer compounded estradiol in a cream as it is natural and bioidentical. There are no studies to compare head-to-head the estradiol gel product to a compounded cream. What to consider when you choose between these two formulations, other than it's covered or not covered by my insurance? The compounded estrogen is usually highly personalized, and the dosage can be tailored to the individual. The sky's the limit as to what we can increase or decrease or start a patient at, whereas the estradiol gel comes in predetermined available dosage, which can only be customized by applying either half a pump, 1.5 pumps, or 2 pumps of the same dose. So it's a little bit more difficult to customize. There is no available injectable estradiol for women. However, there are available estradiol pellets. The pellets are compounded, bioidentical, and they're not compounded by any pharmacy. There are specific pharmacies that are really good at compounding pellets. The estradiol pellets are inserted 3 to 4 times a year by a trained professional. They can be customized, and they're very convenient. You come into the doctor's office 3 to 4 times a year, you get a shot, you walk away. Very convenient. All you have to do is remember to take your progesterone. However, they cannot be removed once inserted in case there are side effects, and there is some mild discomfort in the area of insertion that varies from a few days to a few weeks. And last but not least, I want to touch on progesterone. Progesterone is a bioidentical hormone. Our body makes progesterone, not progestogen or progestin. Those you might also find under the name of medroxyprogesterone acetate, desogestrel, etonogestrel, levonorgestrel. These are all synthetic chemical lookalikes that want to be progesterone, but they're not. Some of them are not even similar to progesterone in their chemical structure. I really dedicated an entire podcast to this topic, so if you'd like to know more information, please go back and listen to the episode, Our Body Needs Progesterone, Not Progestin. There's plenty of information there. However, for the purpose of hormone replacement therapy, please know that progesterone is available to take by mouth as a gel cap, as an FDA-approved progesterone called micronized progesterone. The brand name is Prometrium. It is bioidentical, but it also contains synthetic ingredients like peanut oil, gelatin, glycerin, lecithin, titanium dioxide, DNC yellow number 10, and FDC red number 40. So it has colorants. There's a orange colored one for 100 milligrams and a slightly yellow colored one for the 200 milligrams. In contrast, bioidentical progesterone can be compounded by a compounding pharmacy from Mexican yams as a capsule, and those can be instant release or sustained release. This is something your doctor will decide based on your symptoms and your goals. Progesterone is also available as a dissolvable troche and as a skin cream application. I think I provided a lot of information about all these 3 major sex hormones that are pretty much the core of hormone replacement therapy. Next episode, I would like to talk about bioavailability and hormone levels with some of these methods, which is important when you choose what hormone replacement therapy is best for you. So I'll leave you here please come back and listen next week. I'll have more. If you liked the information you heard and you'd like to hear more, please subscribe and follow my podcast. Should you find the content helpful to not just you, but possibly others, please share it and feel free to leave us a review. You are welcome to join the Facebook group, The Warrior Optimizing Wellness MD. I certainly hope that you've heard many things in this podcast that made you go, wow, I did not know that, or wow, I'd like to know more. So keep listening and I'll keep talking.